Loma Linda, California. Here, the edges of LA stretch into the arid neighborhood of the country's most dangerous snakes. ER doctor Sean Bush and his team are ready for action when snakes and humans collide. It's early May, and as the hot summer winds begin to blow across the desert, the snakes are on the move, and bite season is about to take off. Now the team will face their biggest challenge yet, here on the front line, home of the VenomER. The VenomER team covers 40,000 square miles of desert, homes, and forest. The warmer summer weather has made the snakes more active. The team counts on a quick response from ambulance, fire, and helicopter crews to get snakebite patients to the hospital fast. For Dr. Bush, every second counts.
From the moment venom is injected, destruction starts to occur. It digests your tissue, it interferes with blood clotting. So the quicker you can get anti-venom on board, the sooner you can stop that irreversible damage from being done. That's why I say time is tissue. And that's why I recommend helicopters, mixing anti-venom early, and getting to the medical care as quickly as possible.
The San Bernardino Sheriff's Air Division has helicopters dedicated to field rescues. Many local medics offer their services to Sheriff's Air, and Sean has decided he wants to join them so that he can get to his snakebite patients more quickly.
And losing
He may be a medic in the air, but he needs to be as fit as a police cadet on the ground. Today, he's being put through his paces by Academy Class 153 at the Sheriff's Department. Helicopter missions can be tough. The team must always be ready for the worst, so Sean has to be prepared to drag unconscious victims out of trouble.
Well, I want to get out in the wilderness more because that's where the snake bites happen. And, you know, I talk about snake bites all the time, but I can't really consider myself an expert unless I'm out there amongst them.
Being out in the field with the snakes will make him the ultimate authority. The Academy's training officer, Dan Davidson, is pleased with Sean's showing.
Well, I tell you, I had a little bit of a doubt with Sean, but he's exhibited great abilities, and he's passed all the tests with flying colors. He's done a really good job. His medical abilities are far exceeding many of the people on our team. His expertise with snake bites and our wilderness activities here, he'll be a big asset to our team.
This is just the start of Sean's training. During the next few months, he'll learn how to work in the helicopters and how to navigate on the ground. It'll be a tough challenge, but right now, he has an even tougher one to face. There's a serious snakebite victim being transferred to Loma Linda ER. With the ambulance on its way, it's a race against time.
I'm heading down the hill. Yeah, you should go ahead and mix up 6 vials of Crofab and get it ready to go. He's already had 6 at the outside facility, but I want to get another 6 ready to go. Absolutely, he needs that quick. All right, I'll be down there any minute. Bye.
"50-year-old Ross Cook was bitten at Lytle Creek, 25 miles away.
I got a little bit of report. What's the update?
Nothing much. They gave him some 5 of morphine before we left, and he still has the pain. The bite's right here.
Big time pain in the leg. I don't have anything else.
This area, that's where the bite and that's where the pain is. The swelling, and you marked the pulse right there.
Okay.
He stated that he thinks it was a rattlesnake that bit him.
Yep.
He stepped on it.
I know it was diamond there.
Okay.
Pulse rate is 96, totally regular. No allergies. He does have a history of cardiac. Times 5 years ago, he had an angioplasty. He said, take a deep breath.
A heart condition is a major concern for Sean. The venom in Ross's bloodstream will test his whole body. His case is very unpredictable.
You feel like this tingling in your fingers, huh?
Everywhere. Face, finger, everywhere. I
Okay.
feel like I've got a hat on that's tied around my head.
Uh-huh.
Other than that,
My mouth
yeah,
is
hold
all,
on, I marked it right there for you.
it's wiped out.
Feel like a metallic taste in your mouth or funny
And this
taste?
is
Yeah.
Rubbery
the
taste?
Venom they give.
Water tasted funny,
This is
but it's like my nerves are gone.
Ross's whole body is reacting. He's already had 6 vials of anti-venom, and he's certain to need more.
Twitching?
Yeah.
Did you, did you get much relief after you got the anti-venom, or you still feel like, I can see you're still twitching around the mouth here.
Not much yet.
Okay.
Not
All right.
A little bit, just very little.
All right.
The main thing is bothering me is the pain in that leg.
Now, how did
I
it happen?
stepped on him.
Accidentally stepped on him.
I accidentally stepped on him. He turned around and wham.
Ross was taking a break from work and had decided to go for a walk at Lytle Creek. He's an outdoors man who knows about snakes, so is always careful to avoid them. He just didn't see this one. It was a big snake, and Ross knew he needed help. First, he called work to alert them about the bite, then decided to go straight to the hospital. But he wasn't alone. He drove his own van and flagged down another driver to make sure that he got there. It would have been better to call 911, but Ross was focused on just getting to the hospital.
And I see him all the time, but this thing was the biggest rattlesnake I've ever seen. I know I was raised up in Utah and everything, and I'm not kidding you, he was about that big around. He didn't look like a snake, he looked like a tree branch. I stepped on him.
What color was the snake? What did he look?
It was a diamondback. I know what snakes are. He was a diamondback. The only thing strange about it was didn't rattle.
What color diamondback though? I mean, was he like,
Brown.
was he dark blackish or was he slate gray or?
Ross is convinced he was bitten by a diamondback, but Sean suspects a different snake.
You know,
Lytle Creek is southern Pacific rattlesnake country.
a lot of rattlesnakes.
There's quite a fang spread here. We're going almost 3 centimeters of fang spread.
That's about 1.25 inches, the biggest Sean's seen this year.
See the 2 main fang puncture wounds, and you see all the rest of the snake's other teeth. Along here, there's just rows of them here and here. These are the top row of teeth, bottom row of teeth, and that's where the snake bit him, basically like this. And the bigger the snake, the worse, the more dangerous the snake, the more venom you get.
He wasn't long, but he was thick.
Yeah. I recommend another 6 vials be mixed. In fact, Dory, let's mix up another 6 vials of Crofab. Mainly you're just twitching in your face and in the leg and anywhere else you feel like you're twitching?
Well, I can feel it. Like not twitching, but I can feel that vibrating on my hands, my fingers.
Sure.
Yeah, like you said, it's in my face. It's everywhere.
Okay.
But I have a lot of pain in the legs. That's about the only place I
Dr.
go.
Bush can tell that Ross's whole body is affected by the venom. He has muscle twitching in his face and fingers, well away from where he was actually bitten. The lines on Ross's leg allow Sean to see if the swelling progresses.
Okay, so that's 1648. Has this spread since you got the 6 vials in, or do you know?
It's always been the same.
Okay. Did he strike and release, or did he hang
Despite
on?
Ross's insistence that he was bitten by a diamondback, his symptoms confirm Sean's suspicions.
Well, I think this was probably a southern Pacific rattlesnake, partly because of the geographic location, and partly because the way he's acting clinically. He's got numbness, and he's twitching all over. He's got the fasciculations. He's also swelling, and these are characteristics of southern Pacific rattlesnake envenomation. People can definitely die after a southern Pacific rattlesnake bite. In fact, we've had a couple of patients that have had near-death experiences after bites by southern Pacifics.
A crucial phase in Ross's treatment begins when VenomER returns. In the Loma Linda VenomER, Ross Cook is in severe pain after a bite from a huge Southern Pacific rattlesnake.
Yeah.
He's receiving heavy medication, and more Crofab antivenom is being prepared.
Okay, I see. What do you want it mixed with?
Let's go with,
Mixing Crofab has to be done just right. It's a team job, guided by Sean Bush.
Do we need to, we don't want to shake these, we just kind of...
yeah, let me show you. You can roll them like that, or you can kind of swirl them like this. It's to be stirred, not shaken. Just unlike 007's martini, right?
Going violent there.
You can put all the rest of them in there now.
It takes 30 minutes to go into solution. The intravenous infusion takes over an hour. So far, Ross has received 12 vials, but there's a strong chance he'll need even more.
I'm a fellow snake enthusiast.
Ross's family is on their way to the hospital. All the medical team can do now is watch and wait. The ER team deals with hundreds of patients every day from all over the county. San Bernardino Sheriff's Air have just brought in another snakebite for their new team member in training, Dr. Bush.
And then we're just giving him in his other 18 gauge, the liter of fluid.
Andrew Chavarria was bitten on the thumb trying to protect his daughter while they were having a picnic.
Let's come in here and give me a report and let me know what's going on. You brought me the snake.
I did.
Thanks for that,
Absolutely.
man. Appreciate it. And it's live and
We
everything.
already named it. What was his name? Skippy. Skippy's his name. And he's alive in the refrigerator if you want him.
All right.
Yeah. He's trying to
Dr.
jump
Jeff Grange is another ER doctor who volunteers for Sheriff's Air shifts and has 8 years of experience in the air.
You're doing Sheriff's Air today, huh? Yeah. Very good.
Dr. Bush will take great care of you.
All right, thank you, man.
Absolutely. Take care.
All right, you too.
Thanks, Jeff.
See ya.
Now, and tell me again, what were the circumstances? How did you get bitten?
Kids were playing around some rocks by the lake. They were saying snake, snake, and they were trying to get it, and I went over there to shoo it away, and it got me in my thumb.
Andrew made the mistake of trying to move the snake, not the children. He should never have gone near it, let alone picked it up.
So, got you right here, huh?
Yeah.
All right, he's got a little, you can see he's got a little blister. Just take a measurement between the fang marks here. I get about a centimeter across, so it's a pretty small snake, huh? And then it doesn't hurt up here?
No, not really. It hurts under my arm.
It kind of hurts up on your arm up here, right here? Okay, that's the venom traveling up the lymphatic. This is definitely Southern Pacific. I mean, look how his thumb's twitching.
Apparently.
With 6 different species in the area, seeing the snake that caused the bite really helped Sean's diagnosis and the treatment.
Reluctant to reach in here. It's in here, it's taped shut real well. Apparently it's still live and quite small, but they thought cooling it down would maybe lessen its mobility a little.
Get him out of the fridge.
A fridge is no place for a snake. Luckily, Sean knows what to do. And he knows better than to handle the snake.
There you go.
What's that?
Scoop him into the thing here.
Excuse me. What kind of snake is it?
It's a Southern Pacific
Is
for
it?
sure, yeah. Just what I suspected, because he's acting like a patient with a Southern Pacific rattlesnake bite. There he is. Well, he's doing pretty good. I think he's just going to have a mild envenomation. He's about halfway into the infusion, but I'm still waiting for the labs to come back.
With Andrew's treatment underway, Sean heads right back to see how Ross is doing.
Should be there like that for what happened.
Ross's wife, Lenora, and one of their sons have now arrived in the ER. Lenora is a nurse at another hospital and has treated snake bites herself, so she knows what questions to ask Dr. Bush. She's worried about the effect the venom will have on Ross's weak heart.
Good.
Being in the profession, you tend to maybe think things are a little worse or can become worse than they probably are. So with that in mind, I try to keep myself saying, this is not a problem. He's going to be okay. He's in good hands. and I just try and think positive, things are going to be fine.
Right now what we're going to do is, this is so painful and so tense that I want to check compartment pressures.
Compartment syndrome.
Well, I'm not sure. I'm going to check the pressure right now. I mean, because, you know, snakebite can mimic a compartment syndrome.
Compartment syndrome can happen when the pressure inside the muscle compartment exceeds the blood pressure, so blood can't get through the muscle tissue. This can cause the muscle to die. If Ross does have compartment syndrome, he may lose the use of his leg, or he may even need an amputation.
Started hitting different projects.
The swelling concerns both Sean and Lenora, but it may be relieved by the current dose of anti-venom. Once that's complete, in about an hour, Sean will test the compartment pressure.
It's just almost making you fall asleep.
Find out what happens when VenomER returns on Animal Planet. Sean Bush has a mission: to increase his ER team's knowledge of snakes. Being able to identify each of the 6 local rattlesnakes is a vital diagnostic tool. Here at Loma Linda, his teammates need experience with snakes, and they can get that safely at the University Snake Labs.
All right, let's check them out. All right.
Rob Steele is an attending physician in the ER, like Sean. Their caseload is the same, but Rob grew up in Michigan, so when it comes to rattlesnakes, he has a lot of ground to make up. Sean knows how to handle snakes safely.
All right, Rob, are there any features that this snake has that stand out for you?
The horns.
Yeah, he's definitely got some horns over his eyes. And you'll see he doesn't have any diamond pattern either. You hazard a guess at what kind of snake that is? Here, I'll give you a hint. Watch how he moves.
Moves sideways. He must be a sidewinder.
Ding, ding, ding. Good answer. There you go.
Wow, that's a big one. One hand on the door, 1 foot ready to go.
What features do you notice about that snake?
Well, he's got a different pattern as far as the coloring and everything else.
He's a little bit bigger than the other one, but still doesn't have a diamond pattern. But there's no horns on the head. So that can only be one snake in this area, and that snake would be?
Southern Pacific rattlesnake?
Wrong.
If I keep using that answer, it'll be right eventually.
Eventually, 1 out of 6, will be right. This is a speckled rattlesnake.
Speckled.
He's in.
Whoa. Wow.
All right, what do you recognize about this snake?
Well, he's small. He's got diamonds, no horns. Ooh. And moves quick.
Right. You'll notice he's got the diamond pattern going down his back, and then it fades kind of into bands as you get towards this part of his tail, like the latter 3rd or 4th of his body, right?
Right.
So all these features combined mean that this snake is a what?
Southern Pacific rattlesnake?
And wrong again. No, in fact, you'll notice he's kind of green. Does that give you a hint?
Green Pacific rattlesnake?
No. No. This is a green Mojave rattlesnake. And this snake is super toxic.
Oh, I don't know. I can't see the color. I can't see much.
There's that snakebite folder in the ER, and you never even picked that up and looked at it. You never even flipped through it. Oh, my God.
Well, I don't see a lot of snakes in the ER. I just see the bites.
Moving to the bigger snakes now. All right, so what jumps out at you when you see this snake?
He's very dark in color.
Yep. So what is he?
Southern Pacific?
You got it, man.
Yes.
All right, score, score. This is the #1 biting snake in this area.
Wow.
All right, Rob, so what have you learned today?
Well, first off, don't touch snakes. And how to identify some of these snakes that are indigenous here to Southern California.
Good. Does that mean I don't have to come down the hill every time there's a snake bite?
I'll probably still call you.
Rob has a long way to go, and classes will continue. He can now spot the deadly Southern Pacific, but the team is about to encounter another of the dangerous snakes he's just seen. Dusk is a particularly busy time in the VenomER. It's been over 100 degrees during the day, but when the temperature goes down, the snakes come out.
From your facility with this 7-year-old patient, snakebite victim. Are you aware of this patient?
Mercy Air, that's affirmative. We are aware of the patient with that 11-minute ETA. We'll go ahead and see you in the nurse pad.
Got a 7-year-old boy coming in by air from the high desert. Could be a Mojave, could be serious.
Mojave rattlesnakes are especially dangerous because their venom attacks the body's nervous system.
Hey, how you doing? Hey, buddy.
Kyle.
Hey, Kyle, how you doing?
Dr. Bush.
Come on out, buddy.
The fang marks on his middle finger, and the snake struck him from under the porch.
All right.
And so he really didn't see much of the snake either. Just him, the head coming out, hitting him, and that was it.
There wasn't room for his parents in the helicopter, so Kyle Harden was brought in alone. A scary experience for a 7-year-old. He's taken straight to the pediatric emergency room and is under the care of Dr. Jim Moynihan.
Tetherball. Do you like to do that inside or outside?
Dr. Moynihan is trained to work with children and sensitively coaxes information out of Kyle to help Dr. Bush make a diagnosis.
I was playing with my dog, trying to catch the moth, and it went under the house, so I took my hand up under there to grab it, and the snake got me.
Oh, did you see what kind of snake? No. I can give you some medicine and help you. Make sure you're okay.
John, I think he might have either.
I'm gonna change this.
Might have a non-envenomation
here or anything, okay?
Yeah.
You're just gonna take the tape off there, okay?
I mean, he's got. He's kind of not very specific about where his, this puncture wound is. Now that could be a fang puncture wound, but it could be a puncture wound from something else too. And it doesn't hurt him at all. Does it hurt you? Does it hurt you?
Without clear symptoms, Sean won't start the anti-venom.
I would hold off on the Crofab, hold that, and then we're just going to observe him and see if he gets any signs of envenomation. I would still draw the blood.
Sean isn't convinced Kyle has been bitten by a venomous snake, and giving anti-venom is a risk. It can provoke an extreme allergic reaction called anaphylaxis. Anaphylaxis may cause airways to swell, making breathing difficult. It can also cause a dramatic drop in blood pressure, preventing blood from reaching the brain or vital organs. Anaphylaxis may kill.
How old are you?
7.
Hey, you're being brave. You're pretty tough. You're doing a good job. All right, here you go, buddy. That's for you.
Kristen McLaughlin is a child life specialist. She's looking after Kyle until his parents arrive. She explains what the doctors are doing and reads with him so that he isn't so scared.
Find out if there's anything else we need to do to help you. Okay, I'll be back in a minute. You're doing good.
Sean continues to monitor Kyle.
Tell me, Kyle, let me look at your hand one more time. I'm gonna draw some marks on your hand, okay? Now you think that this is where the snake might have bitten you? Okay, I'm gonna circle that with a little pin, okay? Tell us if something starts to hurt.
Many children are brought in without their parents because of the limited capacity in the helicopters. It's a hard thing for the family to face, and often witnessed by Mercy Air paramedic Shantae Williams.
It's very difficult to take a child without a parent. You know what the parent's going through. Not only is their child injured, but then they're they're flying away on this helicopter, which has got to be quite the emotional experience because you're not right there with your child. And you know that wherever we're going, they're going to have to drive. So they're calling us for rapid transport. And we got here in about 16 to 18 minutes, and they're looking at an hour-and-a-half drive without knowing what's happening to their child. So it's difficult.
I'm starting to get a little skeptical that he was actually bitten by a snake. A couple of things could have happened. It could have been a dry bite. It could have been a non-venomous snake bite. He's got absolutely no swelling, no evidence of envenomation whatsoever. So the literature says that you have to watch people for at least 8 hours to make sure they don't have progression of envenomation. And if he doesn't, then we're just going to let him go.
It's now been 7 hours since Ross was bitten. His wife, Lenora, is anxious, but is trying not to let it show and worry Ross. He's finished his second dose of anti-venom. He's now had 12 vials, but he doesn't seem to be getting any better. The venom is still pumping through his bloodstream. Before he measures the compartment pressure in the leg muscle, Sean needs to check on the swelling.
Okay, so it's still progressing. Right here, does it hurt?
Yeah. Yeah, it seems to be on
Because
the
it wasn't.
back.
How about here?
Yeah.
Here?
Yeah.
That's a little bit of progression. This is the part that, like I said, it kind of looks bluish purple, bruised from the.
Here.
It's going to be more bruised tomorrow. In fact, I anticipate that he's going to have bruising up into his lymphatics up here.
Okay.
That's what I anticipate.
Sean has given him a lot of medication, but Ross is still in serious pain. He's about to start his third dose of anti-venom, which will mean he'll have received 18 vials. Most snakebite patients only need 12.
Yeah, just relax. Yeah, you don't have to fight it and stay. Just relax.
I try not to show my fears to Ross or to the two boys so that they can know that it's okay, it's going to be okay. I guess that's the training that I've had being a nurse. You don't want to show too much fear because then everybody feeds off your fear and you're the one that should know. So if mom's scared, oh my, this must be bad. So Ross is in good hands here.
Ross's condition remains serious, but nearby in the pediatric ER, Kyle's family is about to get some reassuring news when VenomER returns on Animal Planet. Kyle Hardin's mom, dad, and sister have finally arrived after a long drive from the desert. The news that Kyle has not been bitten by a venomous snake is an immense relief for his mother, Angela.
These are my two children. It's very hard. Just because I know that a venomous snake could take them very quickly if they're not seen to. And I know that being in the desert in kind of a remote area, sometimes it's hard to get there medically. But after you find out everything's okay, then it's okay to let down. And it's almost easier to cry now than it was at the time. But I probably was medically worse off than he was at the time. And I was trying to keep him calm, so I'm trying to keep myself calm so that he wouldn't be nervous.
All right, I think he'll be okay. His labs look good, too.
Okay, thank you. Thank you very much.
I think Kyle's gonna be fine. It doesn't look like he's getting any evidence of envenomation. We're gonna watch him a little longer here and make sure that there's no progression. And if he does fine, we'll let him go.
Another patient nearing the end of his treatment is Andrew Chavarria.
How you doing? Can I flip this light on?
Yeah, go ahead.
How you feeling?
Tired.
Tired? Let me come over there. Take a look at that arm. I heard you had some more swelling, huh? Yeah, we figured it'd swell a little bit more. But the pain's pretty well controlled?
Yeah.
Let's see here. It's hurting into here now, huh?
Yeah, on the bottom.
On the bottom, just along the bottom, but not along here?
No.
Here, lift your arm up. Let me see underneath it. Yeah, you got some, just like I thought, you have some bruising up here as the venom goes up your lymph system, your lymphatics, but that blister's a little bigger too. I'm just gonna leave that intact. We're not gonna open that up or anything. That blister kind of serves as a natural dressing, and we'll follow you up in a few days and take another look at that. We got another dose of anti-venom, then we'll probably let you go shortly after that.
Okay.
Does that sound good?
Yeah, sounds fine.
All right. Very good.
But there's no chance of Ross going home right now. He's resting, but with no signs of improving. Sean decides to test the leg for compartment syndrome.
This is a striker pressure monitor. And what we're gonna do is we're gonna put this needle into his compartments of his muscles and check to see what the pressure is inside the muscle. If it's too great, I'm gonna have to call a surgeon. The first one we're gonna get. Oh, I'm sorry.
Oh, I just didn't warn me first.
I should have warned you. Okay. Okay, I'm gonna wipe this. Boy, it is pretty tender though, huh?
Sean will anesthetize the area, but this process can be painful.
Now I'm gonna numb up the area, okay? So I'm gonna warn you. Try not to jump, because I'm gonna numb this up, okay? Hang in there. Little stick, ready, stick. Don't jump, hang in there. How you doing?
Okay.
There you go, just so I can make sure that medication went into your vein, okay?
Hold your leg real still, okay? Real still and relax, and don't move. I numbed him up, and I'm gonna put this needle in here. If it's too uncomfortable, let me know, and we'll just stop, okay?
The needle is 2.5 inches long and as thick
Go in
as
there
a
first.
toothpick.
Then we push a little fluid in, and then we let it come back down and equivalent.
Being a nurse, his wife Lenora isn't phased.
It's below 30. Yeah. I'm just
The
checking to see
striker measures the pressure inside the muscle compartment.
Basically, if the pressure inside this compartment is too great for his capillaries to perfuse, then we got to open the compartment.
Ross may need surgery if the pressure reading is over 30.
I like to see him below 30, so we're borderline here. Actually, here I think I'm in the compartment better right now, and I got 28, 26, between 26 and 29. That one's just below 30. It's real close though. I think we're gonna have to give another 6 vials of anti-venom. We're gonna check 2 more spots, just like that. I need to kind of do that other side
After
too.
more tests of the muscle pressure in the shin and calf, the procedure is complete. It's a very close call.
Yeah. Because none of this would mandate him to have surgery. I think it's going to be lower after his next 6 vials, and then but I want ortho to follow him.
There's no need for surgery, and Ross's heart condition has not caused any complications. But the team must continue to monitor the Venom's progress. The effect of the next 6 vials of Crofab will be crucial.
Most snake bites are subcutaneous. They don't inject venom into the muscle itself, so we don't see compartment syndrome that often. But every now and then someone's borderline like this, and so we got to check compartment pressures and watch the patient really close. And we have an orthopedic consultant that's going to take a look at this guy and see what he thinks. At this point, I think his condition is stabilizing. He's not quite stabilized yet. We want to give him another 6 vials, recheck him and see how he's doing, but he's still having some muscle fasciculations. He's still having quite a bit of pain and swelling. We'd like to see if we can get that reduced, and we're going to watch him overnight, and hopefully he'll be doing better in the morning.
And they'll keep his pain level good, and I'm sure he'll be rested. And this is a night that, a night that he won't forget. He'll think twice. He'll think twice before he steps on that log.
At 10 o'clock, after one of his longest days in the ER, it's time for Sean to go home. He's given strict instructions to the night shift to call him if there's any change in Ross's condition. What will the night bring? Find out when VenomER returns. Ross Cook has taken a turn for the worse. Sean was called overnight and told that Ross had suffered multiple strokes brought on by the snakebite. He was quickly transferred from the ER to the intensive care unit. Ross is now on a life support machine. Throughout the night, Sean discussed the best course of action with fellow consultants. The strokes were totally unexpected. Ross is continuing his course of anti-venom. He's now received 36 vials.
Well, he's doing even worse. It looks like he's had multiple strokes. His heart's doing okay, but clinically he's just doing worse. His whole right side is paralyzed. He's in a coma, he's on a ventilator, and he's not responding to us.
Throughout the day, Ross has CAT scans and MRI scans to assess the extent of the damage to his brain. The team has a dilemma. Southern Pacific rattlesnake venom usually thins the blood, yet Ross has blood clots in his head. While some strokes can be treated by thinning the blood and dissolving the clots, both the venom and the anti-venom in his bloodstream make this procedure too dangerous. Dr. Bush has never seen this before, and there are no other case studies to guide him.
It's kind of personal. I mean, this is my specialty. I feel like I'm doing everything that I can for this guy, and he's just not responding. I'm worried that he might not even survive.
Ross continues to deteriorate. His lab results show blood in his urine, a sign that he could have kidney failure. Sean needs to know more.
Because if his urine turned dark, does it look bloody or cola-colored?
The intensive care unit keeps him up to date with developments.
Like pink, bloody, or cola-colored. Okay, that makes me worried about myoglobinuric. That makes me worry about myoglobinuria. So he could be having, his kidneys could be shutting down. So we need to keep an eye on that. Well, it sounds like he's having more complications. You know, I was telling you that the CK is very elevated. That's called rhabdomyolysis. And what that is the muscle cells rupture, leaking their contents into the bloodstream, and all that floods the kidneys and can clog up the kidneys. And when the kidneys get so clogged up, they'll shut down and he can have kidney failure. Right now his urine's kind of turning dark, as if he's trying to clear this myoglobin out of his system. So you have to give him lots of fluids and keep an eye on that and monitor his kidney function.
Ross is now fighting for his life in intensive care. Senior registered nurse Joanne Oakley, who's looking after him, is stunned at what's happened.
I told Dr. Bush and his family, they all know we're all praying for him, that hoping that there's some miraculous recovery here, because we've all seen that. We've seen cases of people that were told they would never wake up, have neuro or brain deficits that they could not come back from, and they wake up. It doesn't happen often, but you only have to see it a couple of times to be a believer.
By Sunday evening, there's little more the doctors can do. they've tried every treatment using all the resources of this high-tech hospital. Ross has received 42 vials of anti-venom. His family have been at his bedside throughout and are now faced with a dreadful decision: whether or not to turn off life support. Doctors have told them there's no chance of Ross ever leading a normal life again.
I think he's had the state-of-the-art treatment for his snake bite. He's had all sorts of specialists in there, neurologists, neurosurgeons, intensivists. He's had the best care available, and still we can't pull him through. There's still a chance that he could recover, but it's looking, day by day, it's looking more and more grim. And either he's gonna die or he's gonna have a permanent disability. He's gonna be permanently unable to move his right side, unable to speak, communicate, and hopefully he'll recover from some of that, but we just don't know right now.
Three long days after he was bitten by a Southern Pacific rattlesnake, Ross Cook's family has to make the most difficult decision of their lives.
Ross Cook died at 10:08 p.m. last night from very rare complication associated with rattlesnake bite. I don't know, I'm still just in total shock that it actually happened. I can't believe that he's died. I mean, we literally treat hundreds of snake. We've treated hundreds of snake bites here, and they always walk out of the hospital. They always do fine, and this is just not supposed to happen.
Ross was a family man. His wife Lenora is now left to bring up their two teenage sons alone. She's struggling to come to terms with what's happened.
It's hard to believe that he's died from a snake bite, especially when people don't die from snake bites today. They just don't. So why? I've taken care of a few snake bites, not very many, and they walked out of the hospital. They had a lot of pain, they had swelling, but they walked out of the hospital, and we were expecting the same thing for Ross.
Ross was only 50 and had everything to live for. The decision to turn off the ventilator was heartbreaking.
We had spoke about this, and thank God we had, because this would have been a lot worse for us as a family. And he'd even spoke about death with his children and things. You know, if I should ever have to go on a life support, if I can come out of it 90 to 100%, then do it. But if it's less than that and I can't walk and talk and do what I do today, don't do that to me. Don't do that to me. So I looked at my boys and they said, no, Mom, he wouldn't want that, and his sister, and we all decided Sunday that we were going to let Ross go.
In the United States, it's rare for people to die from snake bites, but victims do come close. Ross's story reminds us all the power venom has to turn an innocent afternoon walk into a family's sorrow.
I feel like every case shapes the way I treat future patients. And this patient in particular is gonna is going to influence the way I look at the next patient I see with a snake bite. And it's just a very humbling experience. And it reminds you that even if you have all the tools in your arsenal available to help somebody, sometimes you just can't help them. This guy, unfortunately, I just don't think there was anything we could do to save him.
Lenora hopes something positive will come from Ross's death, and his story will serve as a warning to others who live at the edge of the desert on the Venom front line.
Be aware of your surroundings. And even for myself, you know, I don't see them until I'm practically on them. You've just got to be smart. Educate yourself. And, you know, if there's warnings out, there's a reason there's warnings out. Don't just say, it won't happen to me. We tend to do that because it can happen to you.